Hello, 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 Facebook. I'm Dr. Myla Bennett of Ederra Bella Plastic Surgery and Medical Spa in Johns Creek, Georgia. Hi, Loretta. Happy New Year. Sorry, y'all. I got a little bit of a cold. I just been getting colds off and on like started in the fall, and it's like every time I get over one, I have like a week break and then a new one comes. But hello, D, wonderful one, Shamika Willis Brown. Hello, hello. Last week I told you guys I was going to start doing on Tuesdays topics related to motherhood since I'm an expectant mother right now, but I'm going to start that next week. I think it's important since we're at the beginning of the year and this is like the most popular plastic surgery time to make sure that people are equipped to make the best decisions for themselves and get the best results if plastic surgery is something that you're considering. So I'm going to do this one first, and then after that I'll start with my mommy series on Tuesdays. Hi Dee. Hi Kimberly. Happy New Year. So and part of why I did this, like most of the time when I do these talks, it stems from something that I read in comments or whatever on different posts or in different groups and stuff. And so I just want people to be happy with their outcomes, not regretting getting things, in the right hands, you know, all that kind of stuff. So it's just a couple points that I want to hit. I ask you guys to share the video, share, spread the word so people can make good, safe choices. So, hi Cynthia. Hi Helena. Happy New Year. Happy New Year. It's 2018, y'all. 2017 went by so fast. Like, it went by so fast. So, all right. So I'm about to get started. So the first thing that I think is important for you to think about before you embark on plastic surgery is what your motivation is in getting the surgery. Because I find that when I'll talk to people or see some of the things that people write when they're commenting on different pictures or posts or whatever, sometimes it seems like people's motivation for why they're even getting surgery is not the best. And so that can put you in unsafe situations. So if you are getting the surgery because you think it's going to make your life better some kind of way, or it's going to help you get more attention or something like that, that's not the best reason. Usually, in my opinion and in my experience, the healthiest reasons for women to get these types of procedures is to restore themselves, or, you know, if it's something that you don't like, I don't think there's anything wrong with modifying it if you still understand that even if you don't, you're still fabulous. Like, it shouldn't be like, okay, well, when I get my nose fixed or when I get my butt bigger or when my stomach is flat, then I'll be blah, 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 blah. Like, you should know that even if you don't change a thing, you're still fabulous. If you're feeling like your self-esteem and your self-worth is wrapped up in an operation, it kind of sets you up for failure. Because and I tell my patients this all the time, just because I can do it doesn't mean something's wrong with you. Or when they're like, I'm going to be fierce after this. I'm like, you're going to be more fierce. You're already fierce. Like, it doesn't matter. I mean, if you think about it, I know when I was younger and you see some people in the club and it's like a girl or something, you're like, dang, she ain't even all that cute and everybody's all up on her. It's because she was cute inside. Like, she felt good about herself, and it doesn't really matter what you look like, you know? And so, when people feel like their worth is wrapped up in their outcome from surgery, that's kind of a setup for disaster, because what happens is it's actually not wrapped up in that. And so when your life really doesn't change very much, then you start thinking that you need more surgery. And that's how people end up in situations where they're getting more and more and more surgeries, and they start to look, you know, messed up and strange, and they start to do things to put themselves at risk to get these operations. So your motivation is very important. And I think a lot of times is people aren't as insightful into themselves as they should be. But hopefully if you're watching this video, I want you to just try to do a self-check about what you are what you plan to accomplish or what you think is going to happen after this surgery is all over. Because if you're not desperate for the surgery, then you'll make better decisions. There's nothing wrong with modifying something that you don't like. Nothing wrong with that. But you just know that regardless of whether you do that thing or not, you're still awesome. You don't have to have it. It's not going to make you more awesome just because you got a big butt. No, that's not how that works. So that's number one. Number two, this is probably one of the most important things on this list. Make sure your surgeon is a surgeon. So that seems really logical and like common sense, but it's not, because it really, like, that's probably one of the things that drives me the most crazy, gets under my skin the most, and the hardest thing for me to ignore and not answer and not put a comment when I see certain things. But your surgeon needs to be a surgeon. So I want to explain a little bit to you again about, because I explain this all the time, but I'm going to do it again, about the difference between surgeons and non-surgeons in the medical world. So we all learn similar things in medical school, in the 4 years of medical school. But doctors, medical doctors, have to do specialized training after medical school is over for years in a particular area. And medicine is divided into two main groups. We call it surgery and medicine. Like we go down two different paths after medical school. And so some of us go down the surgical path and some of us go down what we call the medicine path. The medicine doctors are like your family practitioners, dermatologists, internal medicine doctors, cardiologists. These are doctors who don't do surgeries. They are like, they're not surgeons. They're not in the operating room. If they went in the operating room, they wouldn't know where to put their hands. Like they wouldn't, they're not surgeons. So they go down anywhere from 3 years to 6 year track in their specialty, with no surgical training at all, and then anywhere from 3 to 6 years after medical school. Then the surgical tracks, there's lots of them. There's plastic surgery, neurosurgery, orthopedic surgery, general surgery, cardiothoracic surgery. It's all these different surgical tracks. So if your plastic surgeon should have gone down the plastic surgery track. They should not have gone down. They certainly should not have been down the medicine track. And if they go down the surgical track, it should be a track that leads them to plastic surgery. Before they're done training, they should already have been trained to be a plastic surgeon. So residency and fellowship training, one of those two things should have trained them to be a plastic surgeon. It shouldn't be, I took a course or I went and trained underneath this other doctor who taught me real fast over the course of a week how to do plastic surgery. It took me 6 years after medical school to learn plastic surgery. So it's not really logical to think that somebody can learn it in a week. So at the very least, the surgeon should be a surgeon. So if the person is a dermatologist, a family practitioner, you shouldn't be going to them for your plastic surgery. That is going to get you in trouble much faster. I'm not saying that every plastic surgeon, just because somebody's a plastic surgeon, they won't have complications. Every doctor gets complications. Every doctor. But you are less likely to have that happen if the person was surgically trained and specifically plastic surgery trained. So a lot of these crazy complications that you see, these horrific pictures of really bad complications, like when people get necrosis, like which is when the tissue dies, like the skin and fat just dies, and they get having all these different surgeries to try to clean up all the dead tissue, and their belly's disfigured or their breast is disfigured and all that kind of stuff. A lot of that is issues of blood supply. And there's no other specialty that learns the blood supply to the extent that plastic surgeons do. Like, there are so many blood vessels in your body, and there's so many rules to making sure that if you cut into somewhere, that you're going to end up with enough blood supply to keep stuff alive if you remove something or you try to move something to a different place from where it was before. And we are the only specialty where that really matters. Like most, because we're cutting in the skin. So the skin doesn't have, the skin is, you see, it's like it's the biggest organ on our body, and it's fed by blood vessels all over the place. But if you cut a big chunk out of it, or if you cut it out in the wrong way, it'll make stuff die. So you have to know the patterns of blood supply implicitly to keep stuff alive. And when you see people with these really awful complications is when people are violating the laws of anatomy and physiology. And medicine doctors don't learn it. That we, like, literally in plastic surgery residency, blood supply was the thing we talked about all the time. Like, everything we talk, any topic we talk about, the blood supply is first. Like, that's the foundation. What's the blood supply? What's the blood supply? What's the innervation? So no other specialty does that. It's like the foundation of plastic surgery. And that's the part that's missing for a lot of these doctors who are trying to practice plastic surgery, winging it. Like, they're missing all of the fundamental stuff that we learned that was ingrained in our brains for years. Like, it's certain stuff that I know that I don't even realize I know. Like, I just know not to do, like, no, I can't do that. You know, like, I don't have to be sitting there saying, okay, this is the blood vessel. Cause it's just like burned. It's like etched in my brain. Like, it was etched in my mind. So you want to make sure that the person that you are allowing to do these types of procedures on you really understands all the fundamentals, because that sets you up for the best chance of being complication free in your procedure and not ending up being one of these bad Facebook posts, in a horror story. But people think it's like, I'll see posts and people will be like, oh, I'm looking for a surgeon in Atlanta. And then the folks will start listing names of people. And some of the names that pop up most consistently are not surgeons. One of the people in particular, I'm not naming no names, is a dermatologist. And I know for a fact that she has jacked people up because they've ended up in my office trying to get fixed. So sometimes they get it right by mistake. And that's the dangerous part, when they get it right by mistake, because those people will be like, oh, she did a great job on me, and da-da-da-da-da-da. But they don't know about all the bad jobs that are floating around, and they don't realize that she did a good job on that person by accident. It's like Russian roulette.